If you detect any signs or symptoms of cancer, or if a doctor suggests that you may have cancer, it is important to consult a specialist. You should not be afraid of a diagnosis of cancer, but if you have cancer, it is in your best interest that it gets detected at an earliest possible time so that it can be effectively treated. First step in establishing a diagnosis is an consultation by an oncologist. If they have doubt, they will probably recommend a biopsy or an FNAC, which is a needle test. If cancer is confirmed, then further investigations are ordered. They are blood investigations, radiological imaging to understand extent of spread like X-ray, sonography, CT scan, MRI or PET scan. And once diagnosis is confirmed and established, they may order certain special tests like tumor markers and all. This photograph demonstrates a doctor's consultation and examination. Based on clinical findings, doctor will decide various examinations for the primary tumor as well as lymph node spread and evaluate if tumor has spread in the blood as well. Biopsy is probably the first investigation that doctor will recommend. Many people are afraid about getting a biopsy done with a myth that if you do a biopsy, cancer will start spreading. Absolutely no truth in this myth. No trained cancer doctor will ever treat you without a structured biopsy report. It's a very simple procedure. They give some small anesthesia in that local part and take a small bit of tissue and send it for examination. It takes only 2 to 5 minutes and you can start doing all normal activity within 15 to 30 minutes. So one should never be afraid of biopsy or never defer biopsy with any kind of fear. Biopsy and FNAC can be performed in various ways. The simplest is FNAC or a needle test, where doctor pierces a needle where there is a swelling and takes some material. It's completely pain-free and takes only 2 to 5 minutes. If the tumor is within some deeper structure, then you may need to take help of sonography or CT scan to get this FNAC done. Sometimes the tumor is located deep within cavity like in lung or in abdomen. At that time you can take help of CT scan to get the biopsy done. So doctor may advise you to get a CT guided biopsy report to plan further treatment. When tumor is on surface, in mouth or in throat or somewhere in skin, doctor may advise to do an open or incision biopsy. In this case, they give a small anesthesia around the tumor. They take a knife or a punch biopsy forceps and remove a small bit of tissue. This is completely painless procedure. After the procedure, the doctor gives some medication. So for next 1 or 2 days, if you take that medication, you will have absolutely no problem in recovering from the biopsy. Doctor advises various radiological investigation mainly to understand extent of disease spread. Cancer has a tendency to spread not only at the area where cancer is happening but also in the lymph node and through the blood. Various investigations that can be suggested are sonography, CT scan, MRI or PET scan. PET scan is the recent most investigation that has a capacity to detect cancer anywhere in the body if it is more than 4 millimeter size. All these investigations are to be done only if doctor advises them. This photograph shows image of CT scan or an MRI machine. It's completely pain-free procedure. You have to sleep on the couch. The machine takes the image and you will never even realize once the image is taken. This photograph shows the PET scan machine. It is more or less similar to a CT scan or an MRI machine. The second photograph is showing the image that you see on a PET CT scan. This scan has an advantage over CT scan or MRI that if the tumor is spread beyond the area where primary tumor is located, it can still detect it if it's more than 4 mm in size. This test is not useful in a normal person who does not have cancer to be used as a screening tool. It is very important to check the physical fitness of a patient, that if patient can tolerate the treatment completely. So physician will always advise certain tests before starting surgery or chemotherapy, like blood test, X-ray test, cardiogram and 2D echo. These are extremely important and must be done in all cases. There are certain specific investigations which are particular to a specific cancer. These are generally known as tumor markers, and either they are blood tests or some genetic tests. These tests give specific information regarding biology of tumor, response of tumor to a particular treatment, and progression of disease. These are advised in specific circumstances by an oncologist. In summary, do not fear of cancer, don't delay the diagnosis, start your treatment at earliest.